Are KRAS-driven tumors a fairly common marker in various cancers, an ideal target for intravenous vitamin C? Hi there, my name is Dr. Walter Lem. I'm a naturopathic physician with a practice solely focused in cancer care for over 20 years. There's a paper that was published last month from Germany, and the title of the article was High Dose Vitamin C as a Targeted Treatment for KRAS-Driven Cancers. And this was sparked from a case that they were treating who had a more uncommon small intestine metastatic cancer, so duodenal cancer. And when they molecularly profiled this patient, they had a KRAS kind of mutation, but it was a rarer one. That was so it's KRAS mutation A59T. And so what had happened is that on their tumor boards, they actually talked about incorporating intravenous vitamin C. So this is in Germany. And the reason for that is that there's been already a few papers published. So there was actually the Vitality trial from China where they used FOLFOX chemotherapy along with intravenous vitamin C, and they felt that there was a signal in this KRAS mutation population that is somewhat common in colorectal cancers. In pancreatic cancers, it's actually even much higher. They feel it's like over 90% of pancreatic cancers have this mutation. And there was an actual paper published using intravenous vitamin C with chemotherapy, and they had a better overall survival. So, anyways, so this patient had failed first line treatment. They used immunotherapy as first line because they had certain kinds of markers, and that was suggested that it could help, and it didn't work. So then what they did as second line, they added FOLFOX chemotherapy and the combination with intravenous vitamin C, and had a very good response to treatment where there's actually signs of more significant tumor kill. So the question then was posed was that are these kinds of mutations more ideal for intravenous vitamin C? Of course, it was because chemotherapy was given the FOLFOX. We don't know how much of the FOLFOX was involved in this equation, but obviously the addition of intravenous vitamin C did not interfere. So and there was another mutation that they also found of interest, but nonetheless, what this points to is here's a progressive country like Germany where tumor board felt, hey, why don't you add that on based on some of the evidence that's out there in the world to combine FOLFOX with intravenous vitamin C, and it poses further questions that how much more research we need to be exploring in this area, and it's great seeing countries like them and tumor board agreeing on incorporating these two treatments, combining the best of both worlds together.